If you're over 70 and your doctor is still ordering these 3 tests, you need to hear this right now. Because what I'm about to reveal could save you from unnecessary surgery, dangerous procedures, and months of anxiety over problems that would never harm you. I'm a doctor with 30 years of experience, and I'm breaking the silence on something the medical industry doesn't want you to know. These 3 routine tests after 70 do more harm than good, and the research proves it. Stay until the end, because I'll show you exactly which tests to refuse and what to do instead. My name is Dr. Michael Stevens, board certified in internal medicine and geriatric care. And I need to be completely honest with you about something that's been bothering me for years. The medical system is designed to order tests, lots of tests, whether you need them or not. Why? Because hospitals make money, labs make money, specialists make money. But here's what they don't tell you. After age 70, certain screening tests become completely pointless, and in some cases downright dangerous. I'm not talking about tests for symptoms you're having. If something hurts or feels wrong, absolutely get it checked. I'm talking about routine screening tests that look for problems you don't even have yet. And here's the shocking truth that most doctors won't admit. Finding these problems after 70 often causes more harm than just leaving them alone. The research is crystal clear, but big medicine keeps pushing these tests anyway. Today, I'm going to expose the truth. Let me tell you what happens to thousands of people over 70 every single year. They go in for a routine screening test. They feel perfectly fine. The test finds something, a shadow, an abnormality, a suspicious area. Now, the real nightmare begins. More tests, biopsies, anxiety, sleepless nights, family stress. Then comes the treatment, surgery, radiation, medications with terrible side effects. All for a condition that had a 90% chance of never causing any problems in their lifetime. This is called overdiagnosis, and it's one of the biggest scandals in modern medicine. A landmark study published in JAMA Internal Medicine in 2022 found that over 40% of people over 70 who undergo routine cancer screenings are harmed by the screening itself, not by cancer. Think about that. The test designed to save you ends up causing the very suffering it was supposed to prevent. Unnecessary surgeries, infections, complications from procedures, anxiety and depression. And the worst part? The medical system knows this, but they keep recommending these tests anyway. In 2021, the U.S. Preventive Services Task Force, the gold standard for medical recommendations, published updated guidelines. Their conclusions shocked even many doctors. After age 70-75, the risks of routine cancer screenings often outweigh the benefits. Why? Because of something called competing mortality. Simply put, after 70, you're more likely to die from heart disease, stroke, or other conditions before a slow-growing cancer would ever cause problems. And the screening tests themselves carry real risks: infections, surgical complications, false positives that lead to anxiety, and unnecessary treatment. The math is clear, the science is settled. So why do doctors keep ordering these tests? OS3 exam. Let me break down the 3 tests you should seriously reconsider after 70. Test number 1, PSA screening for prostate cancer, men only. This is the blood test that checks for prostate cancer in men. Here's what your doctor probably won't tell you. The U.S. Preventive Services Task Force recommends against routine PSA screening for men over 70. Why? Because prostate cancer after 70 is usually extremely slow growing. The numbers: 80% of men over 70 have microscopic prostate cancer. 97% of those cancers will never cause symptoms or death, but PSA screening finds them anyway. What happens next? Biopsies, painful, risk of infection. Surgery, risk of incontinence and erectile dysfunction. Radiation, bowel problems, fatigue. All for a cancer that would have stayed dormant forever. A 2019 study in the New England Journal of Medicine followed 10,000 men over 70 who got PSA screenings versus those who didn't. Result: no difference in death rates, but the screened group had 5x more surgeries and complications. My recommendation: if you're over 70 with no symptoms, no urination problems, no pain, skip the PSA test. It's not worth it. If you do have symptoms, that's different. Get evaluated. Test number 2, routine mammograms, women over 75. Mammograms have saved countless lives in younger women, no question. But after 75, the math changes dramatically. Here's why. Breast cancer found after 75 is typically slow-growing. It takes 10-15 years on average to become life-threatening. But if you're 75, statistically you have less than 15 years of life remaining. Average life expectancy is 87 for women. Translation: the cancer found on a mammogram at 75 will likely never harm you before you die of something else, but the screening can still hurt you. The risks: false positives. 50% of women who get annual mammograms for 10 years will have at least one false alarm. Unnecessary biopsies, painful, anxiety-inducing, risk of infection. Overtreatment, lumpectomies, mastectomies, radiation for cancers that would never progress. A 2020 study in Annals of Internal Medicine found that women over 75 who stopped mammograms had the same survival rate as those who continued, but the ones who stopped avoided all the anxiety, biopsies, and unnecessary treatments. My recommendation: if you're over 75 and healthy with no symptoms, no lumps, no discharge, no pain, consider stopping routine mammograms. Discuss with your doctor. Make an informed choice. Don't just do it because it's time. Test number 3, colonoscopy screening after 75. Colonoscopies are one of the most effective cancer prevention tools. If you're in your 50s and 60s, but after 75, the benefit drops to nearly zero. Why? Colon cancer is slow-growing. It takes 10-15 years for a polyp to turn into dangerous cancer. If you had clean colonoscopies in your 60s and you're now 75 plus, your risk is incredibly low, but the procedure itself carries real risks at that age. Bowel perforation, 1 in 1,000 procedures. Anesthesia complications, higher risk in elderly. Dehydration from PrEP, dangerous for seniors. Falls during PrEP, common in elderly. The American Cancer Society updated their guidelines in 2020. Colonoscopy screening should stop at age 75 for people with average risk and previous normal exams. A 2021 study tracked 15,000 people over 75 who had colonoscopies versus those who didn't. Result: no difference in colon cancer death rates, but the screened group had 3x more hospitalizations for complications. My recommendation: if you're over 75 and had normal colonoscopies in the past, you can safely stop. If you've never had one or have a family history of colon cancer, that's different. Talk to your doctor. Now, some of you are thinking, so I just ignore my health after 70? Absolutely not. Here's what you should focus on. 1. Tests that matter. Blood pressure checks, cholesterol levels, diabetes screening, bone density to prevent fractures, vision and hearing tests. 2. Symptom-based care. If something feels wrong, get it checked immediately. Don't wait. 3. Quality of life. The goal after 70 isn't to live forever. It's to live well. Ask yourself, will this test improve my quality of life or just create anxiety and procedures I don't need? Now, I need to be very clear about something. I am not saying never get screened for anything after 70. I'm saying have an informed conversation with your doctor. Ask these questions. What are the chances this test will actually save my life? What are the risks of the test itself? If we find something, what are my treatment options and their risks? What happens if I do nothing? You have the right to ask these questions. You have the right to say no to tests that don't make sense for your situation. Don't let doctors bully you into procedures just because it's protocol. Your body, your choice, your life. Imagine this. You're 75 years old. You feel great. You're active, enjoying grandkids, traveling, living your best life. Your doctor says, time for your routine colonoscopy. But now you know the research, you know the risks, you know the benefits are minimal at your age. So you say, thank you, but I'm going to pass this time. I'd rather focus on staying active and managing my blood pressure. Your doctor might be surprised, but you've made an informed decision. No unnecessary procedure, no risks, no anxiety, just more time living well. That's empowerment. Before I close, a critical disclaimer. This video is for educational purposes only. I am not your doctor. I don't know your medical history. Always consult with your personal physician before making any medical decisions. If you have symptoms, family history, or specific risk factors, the guidance in this video may not apply to you. This is about routine screening in average-risk individuals over 70. Your situation may be different. If this video opened your eyes about medical testing after 70, hit that like button right now. Drop a comment and tell me, have you or a loved one been pressured into unnecessary tests? I read every comment. And if you want more honest, evidence-based health information that doctors won't always tell you, subscribe to this channel and turn on notifications. Next week, I'm exposing the truth about cholesterol medications after 65 and why 40% of people taking statins don't actually need them. Remember, informed patients are empowered patients. Take control of your health decisions. See you in the next video.